You know where to press, you know the controls, yeah? And you know where to stand, yeah? Excellent.
Okay, ready? Yeah, nice to meet you all. My name is Beenzu Nicholas, and that's what I do. And we went through the register because probably someone has left.
Beenzu Nicholas, your name, yeah?
Yeah. So I just called up the register, and I hope you remember the 5 exits in
Yeah,
case of emergency. There's one
upstairs, the one downstairs.
downstairs, and also the toilets. Ladies and gents on this floor. Downstairs. Yeah. And so I'll go through the register. Denga Gara. Yeah. Anne Kane. Yeah. Mohammed. Khalid Hussein. Zainab Khalid. Mrs. Sandra Husky. Along that, because my handout is it's a huge document. So what I'll do is that if you have email addresses, just write your email addresses in the email address. So I'll email you the handout.
Thank you.
Okay? The rest is fine.
I did give email on the first walk, the one we filled in downstairs.
Okay.
You know when we write the name and everything, the address?
Yeah.
Oh, we have
enrollment.
okay, fine. Okay. So my teaching today is on can I have that? Medication awareness. And has anyone been on this training before?
Yeah.
Yeah?
Not in this one.
Something similar to this.
Similar to this.
Okay. So the aims of this training is to raise an awareness of medication and make you control drugs, as it says there. Raise awareness in respect of self-handling of medication and working with various forms of medication. So these are the aims. This is what's at the end of the lesson. My aim is for you to understand the 3 aims on the board. Okay? What I'll do while teaching, it's either you can ask questions because of the time limit. You can jot down any questions that you want to ask at the end of the lesson, or during the lesson I'll give at least a fair chance of everyone to ask. But I think it's best to ask at the end of the lesson before we have any group activity. Okay? Yeah. Obviously, you can contribute if you want to contribute, or if you're not sure what I'm saying or what you've seen on the board, you can ask me and I'll explain in depth. So these are our 3 aims. And so medication. What is medication? Can someone just, in your own words, how can you describe medication? I'll start from you.
Medication can be defined as a procedure how one drug or medicine should be introduced to a patient or client with some disease. It's the ways of medication and how it will be, what times, dosage, schedules, everything is medication.
That's great. And anyone else?
Medication can be orally taken, and it's used for everyday living, injuries or life-threatening illnesses. It's used to make us better, basically.
That's great. And it's Leslie.
Medication like you're allergic to it, like penicillin or paracetamol, or
Yeah, that's great. It's a substance that can make us either feel better or sometimes worse. Or it could be lethal. It could be.
What I realized, why it's not worse, because you don't eat much. The client, they don't like eating much. And because you're taking too much dosage, that's what they affect you.
Okay.
That's what I realized in some way.
That's great. That's all right. All the descriptions are given is right in one words. But I would like you to read more again about what medication is, but that's the correct description. And according to this description, it's there. It says a drug is any substance which, when taken into the body, will then modify one of its functions or used in the treatment or prevention of a disease. Okay?
Justified? That's enough.
And then secondly, it also helps in the body. It repairs the body, as you said, it does repair. It could work out right or wrong, or figure out what has gone wrong in the body and correct it. And it also makes us feel better and function correctly. For example, if you've got a headache, what's the first thing you think of? Paracetamol. As long as you take the normal dose as advised, you feel much better. But at the same time, if you take too much of it, it could either cure or kill. So we have to be very careful when taking medication. You have to take it according to prescription.
Otherwise,
Yes.
And like I gave you answer as well before, like, you know, when they don't eat properly and they're just taking the medication because you have to give it to them on time, that could pose them as well, isn't it?
That's it. It's there.
But it tells you, doesn't it, if you're allowed to eat an hour before the
And
doctor should
after.
take, yeah.
Yes. Like things like some steroids, sometimes you have some antibiotics. It tells you eat with or before,
Yeah.
after. Yeah. Many medicines and drugs are actually forms of poison. Therefore, must be used correctly as prescribed. And also, that is why many drugs have a limited amount to be taken in 24 hours. As we say, there must be a gap. Or for example, paracetamol. When you're given, looking at service users, especially those who are self-medicating, you can notice that at lunchtime you've observed them take a certain medication, and then all of a sudden they will try and get the same, probably before time, like probably tea time in the evening. They'll try and get one. What do you do? You tell them it's not advisable to take it because of a drug would be poisonous, isn't it? And also you have to be, they must have a limit amount to be taken at any time in 24 hours. Otherwise it could be an overdose and can cause severe liver damage or death. Not more than 32 tablets can be purchased from a pharmacy unless a judgment call is made. It is the purchaser's interest to have more. So for example, the only instance, which instance would you think is right for someone to go to the pharmacist, for example, and say, get over 32 tablets?
If it's to do with an illness and the doctor's actually prescribed it and it's on the prescription, it is allowed. But to actually go over to a pharmacy and say, I want more paracetamol. People do it, they go to different pharmacies.
I had the blister packs. They're normally in the blister pack Monday to Sunday. And they have like mornings, afternoons, in the evening.
That's when we put them in.
Yeah, that's when the doctor.
Yeah, it's ready. It's the doctors that
Yeah,
go
but
to
you
the
say when
pharmacist.
you prescribe,
Yeah,
when you actually purchase
Oh,
it.
okay.
Yeah.
And so that's a picture of an example of what you look like from a drug overdose. The service user could react. There's certain symptoms that you look out for.
And they can have a stroke as well.
Exactly.
If they're allergic. Because I've had a stroke, the doctor gave me the wrong medication and I had a mild stroke in my mouth. Yeah.
Oh, sorry.
It was like
Implications of
There's some money happening.
firstly, maybe not checking what allergies, reactions,
It was a
any
family
stages
doctor.
of
It was a family
reaction.
doctor. That's what we did.
So many medicines and drugs are actually from, we've said about that, and also we've said about a maximum of 16 from a place like supermarket. So you can only get a maximum of 16 from places like supermarket and 32 from the pharmacy unless judgment call. And acts relating to medicines, we're going to briefly go through them. The acts are relevant, and these are the Medicines Act 1968, which says that pharmacists must supply the medication to the care home, and this must be done on receipt of a valid prescription. Why do you think that is so? That pharmacists must supply medication to a care home on a receipt of a valid prescription. Why is that important?
There's so many service users there, so it's very important that individual person has that prescription entirely for themselves, because they're on medication, they will have.
Okay. And sorry, what's it like?
Take up.
Okay, what do you think to say about that?
Or to make sure that they don't take overdose.
Okay. It's a valid prescription. The only people who are licensed to prescribe are who?
Doctors.
And who? The
Nurses.
list
Nurses.
of prescribing nurses,
Doctors.
doctors, prescribing nurses, or pharmacists.
Pharmacist can
Yes, they can prescribe. That's what it says, a valid prescription. Otherwise, you don't just give medication to SMEs users if it's not prescribed or if it's not on the right patient. Okay? And also, there's a Misuse of Drug Act 1971, which governs the use of drugs that may be abused, controlled drugs. There's what we call controlled drugs. And they must be controlled in respect of storage, administration, and disposal of controlled drugs. Can anyone tell me an example of a controlled drug you've heard of or come across? A controlled drug could be things like morphine, morphine,
or
sleeping
like
tablets.
sleeping tablet, exactly.
Yeah, sleeping tablets, which could, those are supposed to be stored away because they would actually cause a lot of harm if they are taken wrongly. And some people will use it as drugs unnecessarily, that would cause dangerous lives. Yeah, so it's important to have them, stored away appropriately. In nursing homes, you find that they're locked away in what they call controlled drug cupboard. Yeah, and things like that. So all those medications that should be retained should be documented and ensure there's a drug audit trail, and this must be completed. The reason why there should be an audit trail and completion of returns, so that when the nursing home not using any of the drugs, there's no need of them being in the home if they've been discontinued, for example. So the only way, you cannot keep drugs that have been, for example, discontinued, so they have to be kept in a register and returned to either pharmacy. Normally nursing homes don't have, they have to find their own license of medicines or returns. Yeah, and medication must also be retained to the pharmacy where they are destroyed. They should not be left around, hanging around in the home. And also collection of medication, this must be entered into the register. So if medication is collected even by an in-house pharmacist, it should be recorded. Or if it's delivered to the nursing home, it should be recorded. Yeah. And also, when clients pass away, they shouldn't be thrown away immediately, because sometimes they need some kind of coroner's inquiry to at least live up to 7 days. So if you find that maybe on a shift and the service user passes away, and they tell you to pack up all your stuff, don't make a mistake of taking the drugs and going, because
You gotta give it back in it.
they give it back, and because of the coroner's inquiry, so it's important, because sometimes it could be one of the causes of the death. Okay. We've spoken about disposal of medication and storage, and even if you find one tablet on the floor, there's a protocol you should follow to dispose of it. If you're not sure, you still don't pick it and give it to the patient thinking it's theirs. For example, you find one when you're trying to give a cup of tea, assume it's this patient's tablet and give it. No, you give it, report it to the manager and give it back. And if you're not sure, they'll tell you how to dispose of it. Yeah, and also it's important to have a monitored dose system in place, and must be ordered and applied when it is needed. For example, those dangerous drugs like CDs, why is it needed? Because we've got in-house patients who need it. The in-house patients who've got dementia, we've got disturbed sleep. They can't sleep, they can only sleep by taking the sleeping. There should be a reason why some certain drugs should be in the nursing home. And I've spoken about how it has to be retained. Unless they have the waste management license, they cannot retain any unused medication. Okay, and drugs leaving the home for disposal must be witnessed by a number of staff. As I mentioned earlier, if for example, they tell you, oh, there's a pharmacist coming at any time, if you hear the doorbell, there'll be someone coming to collect the drugs. Don't just assume you're the only person. There must be another member of staff to witness. To witness that you've given back the drugs. Yeah, and also the person collecting will sign. Yeah, that's what we call the audit trail. So they have a record of what's happening to the medication in their house, whether someone is deceased, no longer needed for the patient. There should be reasons why they're retained or disposed of. Always make regular checks on stock in the medicine cupboard and fridge. You find that sometimes you'll be allocated duties where they say, okay, and tomorrow morning, put your supervisor, I want you to go through the fridge cupboard, to go through all the medication in the cupboard, in the fridge, sorry. And what would you look at? You look at the expiry dates. So for example, you come across something expired, you report it and get it back. And also just make sure they're in good order, they're not broken glass or empty and still in the fridge and things like that. So that I've spoken about, because also eye drops are very important, they could be kept in the fridge, and if you're not keeping hold of checking stock, you find that patients are not having the correct medication at the right time because they've run out of it because of not having what I just told you now. And all stock should be removed promptly. A weekly check in the balance of controlled drugs must be implemented, and also only medicines encourage use of named class should be stored in the care home. It's a repetition of what I said earlier, isn't it? I mentioned earlier that we should do not have medication that's not used lying around. You should have followed the policy and be aware of what policy to get rid of it. And there's certain terminology used for this drug administration, so saying medication. Firstly, I started with prescribing. Administrator. Who's an administrator? The administrator is the person who gives it. Yeah? Person giving. And then we've got what we call administration.
Way of keeping. Ways of keeping.
Yeah? To tell you what you think administration, what do you think it means?
While you're giving this tablet medicine to the
Yes, it's the action. The action you are giving.
Ways of giving. Ways.
Yes, administration. Yeah, it could be an action giving, following certain, rules.
Yeah, rules of administration.
Yeah, what you call, you've heard of a drug chat, yeah? You've had probably yourself or relatives who have a drug chat. That's what you follow with administration. Okay. And then we've got that's act of giving, yeah? And then the next one would be dispensing. What do you think dispenses medication? We mentioned earlier. Tell me one, sorry, what's the name? Yeah, could you just give me an example of another profession?
Dispensing, like going to the pharmacy back in it. They can depose the tablet basically.
Yeah. In dispensing could even be yourself. Just
if I have authority to do that.
Yes, of course. I'm glad you know that. Giving medication is what we call dispensing. Yeah. And then we've got what we call prescribing, recommending and ordering. And we mentioned a list of people who are qualified to do that. Okay? Now, there are certain rules that medication is administered, and which will be oral capsules. That's an example of a capsule. You can just take it one. That's an example of a capsule. Take it one. We've got powder. Who can give an example of a form of medication in powder form?
The flu one, what's it called now? Sorry, that's powder form.
Flu drops.
Yeah.
Oh, the
So
diary.
you can have
The one with the diary.
And that's the,
Diuretic is a form of powder as well, yeah.
and that's the syrup.
so you can have
That's the syrup. And they come in different shapes, dosage, and forms. Those are the different forms.
syrup in it.
That's syrup. Yeah. You can give syrup in a I'll give an activity later. And then always check special instructions before giving tablets. That is, we mentioned without food, with food, yeah.
Give it clean.
There's also what we call inhalation. Thank you. Inhalation. We've got what we call asthma, sufferers. Yeah. That's what we call inhalation. And also we have what we call nebulizer. Yeah, for asthmatic patients, COPD, anyone with a...
Some people call it a spacer as well. You can call it a spacer. They use
That's
the old type, yeah, spacer.
That's it. Do you want to just pass it round? That's the inhaler. Yeah. So that's the nebulizer is the one that you put, it works with oxygen. It's a small liquid that put in an equipment. That's the equipment, yeah, for the nebulizer. Just to soften the phlegm and to clear the chest. So when they use it, when they cough it out because the nebulizers help to
Cough out.
Yeah, to cough out the phlegm that's causing breathing difficulties or breathlessness. And then we've got some. We also have ocular drops or ointment, eye drops. They're given for eye conditions, used mainly for older people who suffer from glaucoma. And it must be recorded on the mass chart. A mass chart is a drug chart. It's another name for drug chart. And glaucoma is a form of blindness. Okay? You can give it either as an eye drop, which is ocular, or eye ointment. When giving eye ointment because of infection control reasons, it's not as the consistency of the eye drop and the ointment is different. So
It's a liquid.
yeah.
And that one is not.
yes. So you find that sometimes when it's liquid, they'll give one for both eyes, and or they'll give one for because sometimes one will have one problem and the other is okay.
Yeah, in that
Yeah.
case.
Yeah. So they'll always put two, say left and right.
So,
So when
it's
you're
not
helping,
cross-contamination.
yes, yes, they'll say left and right. So you also have to read what's written on the, otherwise you can lose. Yeah. And for the ointment, it has to be above eye, applied 2.5 centimeters away from the eye, from the back corner there, yeah, to there. And explain to them, get consent from them. I'm going to help you with the eye ointment. I'm gonna lift your eyelids to help. You have to always talk to them, otherwise they'll, yeah. And also explain to them that because of the eye ointment, your vision is gonna be blurry. So they don't go, this is blinded my eye. Yeah. And then we have eardrops. Usually supply with an applicator bottle. I think you've got an idea of what I'm talking about. You know, like when you're making turkey.
Yeah.
You know,
you actually, it's like a spatula, you just squeeze the top.
Squeeze, yeah. It's the same as what I don't know if you make turkey, you know that long thing you take where you keep squeezing the fat to put it all in the turkey. It's the same, it works the same way. Yeah. And it will tell you how many drops to put on each ear. Usually with that one, you'll just give one applicator. And the best way to do it is tell the patient to lie on the side, put whatever is written, 1 or 2 drops, let them stay there a few minutes for it to soak in, and then tell them to stand in their ear on the side and put 2 or whatever is prescribed, and let it sink in. Okay? And also we've got what we call subcutaneous medication, insulin for diabetic patients. It's a small needle which most of the patients are self-medicating with insulin. You know what diabetic patients go through? It's about when the blood sugars is controlled by insulin. They could be either high
or low,
which is hyperglycemic or hypoglycemic. So yeah, hyper and hypo. So you'll be trained. I don't know when you start work. Maybe some of you have skills of checking blood sugars. And most of the patients are self-testing as well. So they know when they have to give the insulin, when they don't have to, or if they are on tablet only, they know they'll tell you, can I have a Lucozade? Yeah? Can I have a Lucozade? Can I have jam, toast with jam? They'll tell you when they're hypoglycemic. If you're not sure, don't just get advice from your supervisor or whoever you're working with, supervising me. Tell them, I think she's hypoglycemic.